Good afternoon, everyone. And yes, I'll be talking about electronic medical record keeping. And the disclaimer is that these are my views and my just a breakdown of all the apps and all the EMRs I have used over past few years and what has worked best for me. And okay. So it is basically keeping the entire health record of the patient who visits us. And there's a difference between an EMR and an EHR. So many of us, particularly who practice in Mumbai, they know that we hop different places. I myself go around 7 to 8 hospitals. So my record keeping is a combination of EHR and an EMR. And that's why I wanted to point out this. And in a very developed country which works so much on record keeping, this is a data from some 2008 or 9 paper, where they said that even in US, only 4% of ambulatory physicians had a full extensive record keeping system with them who were going around places, while only 13% had a basic system. So having an individual practice and building it and then slowly growing and keeping the record is of course a task, and it requires some help, manpower, backup, some applications, some devices or a laptop, a printer to be carried along with us. And it is quite cumbersome to do all this when we go around to many places, clinics, if we are not having our own place to start with. So for a beginner, it becomes very difficult because you already have a less number of patients and then you don't have a record of it. And then you don't have a follow-up of the same patient, so it really feels bad. But I would encourage that everyone in their early practice or when they start practicing to use what works best for them and keep record of every patient possible, not only for the medico-legal purpose or any other purpose, but even for our own research purpose, for presentation purpose, and for sharing or pooling the data with our colleagues to make a research paper together. Okay, so why the use of EMR is not so very pro? One is the cost. We all know that the EMRs are very costly. When you buy it for your own hospital or a nursing home setup, it would be somewhere in lakhs, of course. And then having our staff trained to use that particular EMR is another big thing to do, and getting our workflow incorporated in that. Now everybody was happy if suppose in the hospital a new EMR is introduced, the receptionist was happy with what was happening before, the billing department, the record keeping, the IPD, everyone was happy, and comfort zone, which people were into, they don't want to come out of that. So of course these two things matter a lot. And second, these softwares upgrade every now and then. So something like, for example, if I look at some software, there's going to be an upgrade every 1 month or 15 days. And suppose I, as a primary user, I want some new changes, then again I get a routine upgrade done in that. So everyone is not very comfortable with the upgrades happening, and not all the staff in the hospital or our clinic likes that, and they don't want to use it. And of course, we have negative effects of technology, excessive screen time, and too much use of the technology, which probably the patients around us don't like, that everyone is just engrossed in their laptop, tablets, and phones, and they don't give a personal touch. So these are some cons where people would still not prefer to go totally towards an EMR or an EHR. And yes, there are, of course, the benefits lot, as I spoke before and as enumerated here. So how to decide like what we need to take? The first question we have to ask is, am I going to use it by myself, or do I want it for my own nursing home or a hospital of mine? Am I just doing it for keeping a record, or do I want a scheduling app or a scheduling thing for maintaining records, or for the use of just the reception? Do I want it for additional services like for billing, requisitions, or giving some medical certificates or other paperwork? And next, of course, the cost effectivity of it and how to retrieve data from whatever has been entered. So it has to be easy to retrieve. We don't be relying on the company for that. And last but not the least, which is very important, it has to be safe, not only for us, but also for our patients. Although it doesn't matter much in our country, but still, I think in coming years, it is certainly going to matter. And based on all this, over a period of last few years, I have used myself these 3 apps. So the DocSpur is the one which comes along with a pen, which is a Bluetooth enabled pen, and they give prescription paper and you just write and it saves the way it is. Now Practo, which is been famous as well as infamous for various reasons. So there are various different things in Practo, and I have used the Ray and the Quickwell. So Ray is like an EMR for your personal thing, and Quickwell is like an EHR. So when you use it for an hospital, it's usually Quickwell. And when you use it for your personal record, it's Ray. So I have used both of this, and of course the Presco, which is now new in town. And there are many more EMRs. I don't say that these are the only ones. These are the ones I have tried, and Neeraj wanted to just let me know what works best for me. So I'll take you through each one of it. Yeah, not everyone has a wonderful handwriting, but still some prefer a handwritten prescription, and DocSpur is the one which will enable us to do that. And if suppose somebody wants to have their own proforma, they have too many fields to be tick, 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 then the DocSpur is again a very good thing because it just digitizes your entire proforma. You don't need more of skill level because now it's just like a paper and somebody is using this pen. What you need is just a little more thing to sync that pen with your device and the network in the room or the hospital, or it can be synced offline later as well. And then the patient receives a soft copy of the prescription through the app itself. Okay, and so what all comes with this app? So DocSpur provides around 1,000 prescriptions which are printed in the format you want. They give 3 copies free complimentary. After that, they charge for it. There's a pen which costs around 10,000, and they give refills with it. So unfortunately, they're only blue refills. You don't get a black. I think it's for the record keeping, they have that color. So somebody who's fond of using different color refills, maybe they might not be very happy using it. And then it comes with an app and a maintenance and a yearly charge of approximate around 13 to 15,000 for a year. So all this is there, and I myself got 3 prescriptions done like this. I see a lot of CP, so I got an entire CP proforma done, and I just tick everything like the birth history, the milestones, all angles, all spasticity, everything in that. And then this gets saved as a written prescription in the app. And each of the prescription comes with a scan code, and I have to just open the app, or outside the receptionist can already do it. And with the enabled pen, just write on it and it saves. I used this app for a while and I was not very happy with it, and I got a hell lot of prescriptions printed. And the worst part was I had to always carry these prescriptions with me. I had to carry this pen along with me. And now I had an additional device which I had to charge other than my phone, power bank, a smartwatch, and blah, blah. After all these devices to be charged, one more thing was added to charge. So I was not very happy. And of course, as I said that there was offline syncing possible, but then, overall it was okay to use. And we can save the pics of x-rays in the app additionally. And at the end of the month, there would be a monthly Excel of whatever patients have been seen. What was not the good point with them, their tech support was not very good. I mean, I used to not get the support very well. And the best part was just writing a date here, and it would automatically give the next appointment to the patient. So the moment I had a handwritten date, suppose tomorrow's any date, so patient would get a message that you have an appointment on this date, and it would get scheduled in the calendar as well. So I stopped using that, and over a period of now like almost 7 years, I have been using Practo Ray. And I am very happy using this despite of the various controversies involved with Practo, and I'll let you know how it's safe to use and stay away from those problems. So this is the browser, how it would look in. So this is a monthly view of the OPD or the IPD or the operative record. Second is the number of patients they can be saved. And third is communication, which I have not enabled. It's like sending out some messages to patients, which I don't want to do. It's annoying. I don't use it for billing purpose, but somebody who wants to use, they can do that. Apart from that, there are some settings, and then there are other integrations and things to be used. So these are basic settings which you can set to make your own prescription accordingly. And most important is, yes, so why there is a problem? So we have to stay away from these things. So these integrations, I always said no. So Practo gives us an opportunity to kind of solicit patients by doing some advance payments. That's a totally no. Just stay away from it. Apart from this, Practo has another 2 such programs, that is Practo Reach and Practo Consult. Just keep them off and just be non-available for those things. Once you do all this, what people complain that we lose patients, our patients go elsewhere, or our record is being saved, or patients are being directed to some particular pharmacy, all that is totally avoided. So if you want to use an EMR, use it like a EMR. Don't mix it as a branding app. Once you mix both of it, then you're going to have trouble that you're losing data, you're losing patients, and this is the problem. So focus on the EMR part, not on the branding part, and branding can be done in some other way. So the same app is on the phone, and it's very easy to use on the phone. So we use it on 4 different devices. 2 of my secretaries, they can add appointments to whichever hospital I want, the way they want to use. And like I said, stay away from all these branding things on that, and use it for simple purpose to just add appointments and give appointments which can be synced and be seen by all the people at once. And we can use any number of devices. The best part is how will it look. So suppose this is the patient and I see it in some other hospital where I have recorded, the notes in their EHR. So I'll just put the PDF in this. So now I have a record of this patient. And now I know that I have a OT of this patient on so and so date. And then I can save the intra-op pictures from the phone in this app. So all the pictures remain in the phone. And subsequently, so there's just last one slide. And subsequently, I can see the follow-up notes and the follow-up date for the same patient. So Practo is actually very easy to use, and it's a wonderful app for someone who wants to individually use it. And for a nursing home system who wants to go totally paperless, I would suggest that Presco is one of the most wonderful apps because it gives a tab and it can be used to just use like handwritten pages. And whatever papers are there in your file, they just are there in the tab. So it's a personalized system for your own nursing home, for the staff, for the nursing staff, for everyone. So to conclude, I would say that both of these apps are wonderful apps considering what all our needs are and how we want to use it. And what is important is that none of this app, they help us in doing ICD coding of diagnosis. So if I want to fetch record of some particular diagnosis, then it becomes difficult. If I want to see how many DDH patients I saw or how many clubfoot patients I saw, that I can't do. And for that, I manually keep another Excel sheet for the research purpose. And most of the apps don't help us do that, apart from the EHR systems, which will enable this. And yes, lastly, I would say that no matter how fancy the technology is and how useful it seems to us, time-consuming, we should be remaining connected to our patient and not be all the time engrossed behind the computer or in the tab or the app, and use what works best for you. So for scheduling purpose and record keeping and image keeping, I think Practo works wonderfully. For a nursing home, yes, the Presco or any other similar app works wonderful, like even HealthGraph works on similar records. And yes, it's wonderful for record keeping, and whatever our requirements are accordingly, that can be used, which works best with our pockets. Thank you.